Welcome to the Academy of Science of South Africa panel discussion. My name is Siyavuya Bulani, and I'm pleased that you have joined us. On behalf of MASSAf and the International Human Rights Network of Academies and Scholarly Societies, I would like to welcome you to this panel discussion on COVID-19 and human rights, perspective on socio-economic rights and violence. This webinar is part of a large virtual event jointly organized by the HR Network and MASSAf, highlighting key rights-related challenges associated with COVID-19 pandemic. I would like to encourage you to visit the HR Network website to access pre-recorded videos that include talks by Professor Ida Nicholson and Professor Jonathan Jansen. Professor Lawrence Gostin speaking on towards a human rights-based approach to COVID-19. And lastly, a webinar hosted by the US National Academies Committee on Human Rights on health equalities, human rights, and COVID-19. I would like to ask participants to only use the Q&A button. We will be happy to receive your questions to the panelists throughout the event. Without wasting any time, I would like to welcome the moderator for today's panel discussion, Professor Christof Heyns. Professor Heyns is a professor of law at the University of Pretoria, a member of the UN Human Rights Committee, and a member of the Academy of Science of South Africa. Over to you, Professor Heyns.
Thank you very much, Dr. Bulani Sia. Thank you very much for this invitation, and welcome to all participants to this webinar on COVID-19 and human rights, perspectives from socioeconomic rights and violence. So I also want to thank the Academy of Science of South Africa for hosting this, the three panelists that we have today. And we'll have 1.5 hours for discussion on a topic that I think is very relevant to our time. It's often said that the pandemic has placed further strain on the fault lines in our society, locally and globally. The universal human rights system, with its universal aspirations, is of course no exception. So COVID came at a time where there's already great pressure on multilateralism and on human rights. But it's clear that in the wake of COVID and the various waves of COVID, there will be severe socioeconomic challenges and poverty that adds to the strains that we have in the system. There are also changes in how violence manifested itself in a time of COVID. In some ways it has gone indoors, and we'll talk about domestic-based violence, but also outdoors it has changed, and in many cases we saw that the authorities yielded greater power, and this has resulted in police brutality. And of course, one of the questions that one then has is, does this mean that human rights is not appropriate to deal with these challenges? Should we look for different answers? Or do we need more of human rights? But we need to adjust human rights and make sure that it responds. And so I think today, coming at the end of a year, when there are many other competing possibilities for our attention, it is still a very good opportunity and a very important topic, and we're delighted that you're joining us to answer this question and to address this question really of how the human rights response should be to the time of COVID. So first then the issue of the more outdoor element of violence in a time of COVID. Just some brief remarks from my side before I give over to Rachel. I think we are all aware of reports countrywide of abuses of power in a country which already has a very high incidence of violence and of deadly violence, homicide, 36 per 100,000 people per year, 5 times the international average, and in which 3 times more people are killed by the police than in another country where this often occurs, the United States. So the massive efforts that went into lockdown and to clamp down on alcohol has for the time being reduced the violent crime rate in the country. But like in many other countries, the levels of police brutality and the reports of brutality have increased. I think many of us remember in April of this year the death of Collins Khoza, which I think put that very squarely on the agenda. And in the meantime, many other concerning reports about the effects of violence, especially on the vulnerable, on the poor, have reached us. Nathaniel Julius is just one example from Eldorado Park. But if one looks more broadly than South Africa at global trends, the Special Rapporteur on Assembly and Association has recently identified a number of trends as far as force during time of COVID is concerned. And he emphasized that the legal frameworks have in many cases been adjusted. Emergency regulations have been adopted in countries, but also derogation from international treaties. There's been a targeting of opposition members and of vulnerable members of various communities, a militarization of police efforts, and harsh measures that are taken, for example, in the context of demonstrations and arrest and enforcement of lockdowns. There's also challenges to the oversight mechanisms and the role that the press and the police can play in a time of COVID, when it's difficult for civil society to mobilize and to exercise its oversight role. And in some cases, the legitimate restrictions that come with COVID have become a pretext for excessive interference with liberties and with human rights, and also resulting in the use of force. And I think in this broader universal context, it's worth emphasizing that new instruments have been adopted on management of assemblies and also on less lethal weapons. So in 2020, this year, in July, a guidance on less lethal weapons has been adopted. But also domestically in South Africa, we know that the South African Police Service Act is being reformed at the moment. And part of the solution may be legal reforms. Part of it may be cultural reforms. And if one's answer is not in the direction of, no, we don't need human rights because they're not up to the situation, but we need more human rights and better and more appropriate effective human rights, this will be the challenge, is to say, yes, some legal reforms may be required, but in many other ways, we are looking for answers to make sure that the human rights project survives and the human rights project appropriately addresses the challenges that come with COVID. So that's very briefly from my side on this sort of external element of COVID. We will now go to our panelists, and our first speaker will be Professor Rachel Jukes. So I want to encourage all of you to, when you have questions, in the meantime, you're welcome to use the question and answer box, or otherwise, after the various panelists have spoken, there will be the opportunity for you to take the floor and present your questions. So Professor Jukes is Executive Scientist for Research Strategy at the South African Medical Council. She has 350 publications to her name. She's a specialist in gender-related and domestic violence, and it's on the latter topic that we are delighted to welcome her to speak today. Rachel, you have the floor.
Thank you very much, Christof. And I want to welcome all the participants. Thank you very much for attending today. What I want to do is to talk a bit about COVID and gender-based violence. And essentially, sorry, I'm just sharing my screen. What I'm going to be talking about is helping us think about these three groups of forms of gender-based violence: intimate partner violence in its different forms, physical, sexual, emotional, and economic, intimate femicide being a most extreme consequence of this, non-partner sexual violence, whether rape of an adult woman, child sexual abuse, sexual harassment, and other forms of gender-based violence, trafficking for sex, child marriage, or kutwala. Mainly we'll talk about intimate partner violence and non-partner sexual violence. So I could start off by showing you figures for gender-based violence in the context of COVID over the year. But in fact, we don't have any reliable figures. And I think if you want to think about and imagine the scale of the problem that we're dealing with, it's best to think about what we know about the scale of the problem of gender-based violence outside the context of COVID. And this graph summarizes some of the key features of this. What I've pulled together has been the prevalence of women's experience of physical or sexual violence in the past 12 months from research conducted in a range of different countries. And most of these studies were conducted in the course of the What Works to Prevent Violence Against Women and Girls global program that I was leading over the last few years. But I've put here as well the prevalence figure from South Africa from the 2016 Demographic and Health Survey. And if you look at the blue columns at each side, you see these are two prevalences from South Africa. The one on the extreme right is the national prevalence that we gained from the Demographic and Health Survey. And the one on the extreme left is the prevalence that was found in women's reports of violence in informal settlements around Durban. And this prevalence is very similar to the reports of perpetration from that area from men, and very similar to perpetration reports from a similar type of area in Johannesburg. And what it essentially shows us is that we have enormous diversity and exposure to violence in this country. One of our profound inequalities is in the risk that women face on a daily basis of experiencing violence within their homes from their loved ones, their intimate partner. And if you look at the range of countries in between, some of these countries like the occupied Palestinian territories, the Democratic Republic of Congo, are areas that are notoriously conflict-affected, violence-ridden areas. But in fact, the informal settlements of South Africa actually have a greater risk for women living in them, in the communities where we were undertaking research, than these major conflict-affected areas. And I think that's a really important thing to think about. So enormous diversity and inequality and risk of violence. What's driving violence and how do we explain this? Well, the key drivers of violence, the most important drivers of violence in our country and the ones from which every other risk stem are the structural factors. Gender inequality, the patriarchal privilege that structures gender relations in our country and disempowerment of women, linked to the normative use of violence in multiple aspects of social relations, whether in the home, in the family, raising children, in the community, and in schools, and dealing with conflict in various ways. And integrally linked to these are the structural factors of poverty and low education. And I think it's incredibly important that when we think about human rights, we centrally position women's rights to equality linked to socio-economic rights. And these are key drivers of violence. And obviously they impact individual and relationship factors. And we see here poor communication and relationship conflict responses, which is a key driver of violence stemming from and integrally linked with our structural factors. Poor mental health and substance abuse, integrally linked to the structural drivers, integrally linked to the exposure of children and young people in our society to abuse and trauma. And all of these drive IPV. And I've put at the bottom, as it relates to the international environment, but also South Africa, conflict and post-conflict settings in which gender-based violence is much more common. And we often forget that in South Africa, we are still only 25 years after the end of apartheid. And clearly the legacy of apartheid is writ large across the drivers of violence as they pertain in the country. So what happens when COVID-19 comes along? Well, essentially, we have two key things in play. One is the immediate infection-related stress, and the other are the consequences of COVID containment measures. So we know that infection-related stress differentially has impacted women. They carry more risk more work of caring for others, which places their own health at greater risk. They undertake more domestic and care work, including when recovering after COVID, which can take months if affected by the long COVID form. They're more likely to be required to fill gaps within the family caused by bereavement or by illness of other family members. And they may get much less support during their own experiences of COVID-19, particularly women experiencing intimate partner violence and severe gender inequalities, who may have less access to healthcare and poorer outcomes. We also know that women have been differentially affected by the COVID containment measures. Some women have been confined to home during lockdown with abusive partners, or else with partners who've been additionally stressed by COVID-19, which places additional challenges on the relationship. And if you think back to the drivers of violence, the role of mental health and stress conflict management as key immediate drivers of violence is very important and pertinent in this regard. We've got poverty and unemployment. There's been a disproportional impact on poor families of COVID, and at household level, we know that women bear the disproportional impact of managing the consequences of living in poverty in a resource-constrained environment, and women are much less likely to be working before COVID came along, and so much more affected by unemployment that's been driven by the impact of COVID and COVID containment measures on our economy. And women also are usually responsible for feeding the family and place additionally stressed by the impact of enhanced poverty and reduced income on access to resources for that. And we have heard much about hunger in our communities over the last year growing. If we think about care of children and schooling, women are more likely to have picked up support for children during COVID and additional childcare, particularly when ECDs were closed and schools were closed. And they've also lost access to NGOs and informal community support, particularly at times where our mobility has been restricted, either by direct government measures or by fear of mobility in the context of COVID. I think it's also important to remember that there has been one key benefit for women during this time, which has related to the impact of restrictions on alcohol access. And it's been very, very interesting to see that one of the areas in which there have been benefits for women has been in a reduction of certain forms of violence related to alcohol. So if we look at this figure, what I've done is to put together the impact of COVID with thinking about how it impacts on drivers of violence. And you can see the impact on poverty and unemployment, disrupted education, poor physical and mental health and stress, isolation, either individual, household, or increased community isolation, loss of services, particularly NGO services supporting women. All of these increase risk of violence. They also generate weakening of or in further backsliding around some of our key drivers of violence. So conservative gender norms at times of stress become more entrenched because people who are stressed are less able to take the leap towards more gender equitable views. Conflict obviously rises in times of stress, particularly related to mental health. We've seen a loss of programming that challenges gender norms and roles, the use of violence, particularly because of reduced mobility and reduced gathering ability during this time, which are key modalities used in intervention. So all of these drive intimate partner violence. And we know intimate partner violence itself drives many of these drivers. So we know, for example, that intimate partner violence drives household poverty and food insecurity, much as household poverty and food insecurity drive intimate partner violence, particularly with women becoming more dependent on male partners and losing power within the household as poverty increases, as they have to deal with greater stress, worse health, and less opportunities for productive engagement and earning and greater costs. So if we think about what are the enduring impacts of COVID-19, I think the greatest impact overall has clearly been on the economy, and this will impact women and families for years to come. Poverty is such a key driver of violence against women, and women so strongly differentially experience it in South Africa. The enormous dependence on men feeding into the patriarchal privilege. So this is a phenomenal impact. Integrally related to this are the issues related to stress and mental health and the impact on gender relations, particularly perceptions of success of men. And much as we, I've just been referring to women losing their jobs, we need to remember that men have also lost work and income during this period. And men's perceptions of themselves as successful men are psychologically critical in positioning themselves within their gender relations, particularly because it's women who so often bear the brunt of men feeling that they are threatened and in some ways undermined in their masculinity. And the violence against women is used as a way of reaffirming male dominance and power when men feel unable to gain that affirmation from the broader community and success within other areas of their lives. COVID-19 has massively set back prevention. From the discussions I've been having with NGOs in the country, I have got the impression that prevention of violence against women and girls has largely ground to a halt. To the extent that services are still being provided, the focus has been on responding to violence and providing support and counselling, and that's obviously absolutely critical, but it only responds to individual acts of violence experienced by those small proportion of individual women who experience violence, who are able to access care and assistance, and that does not actually in itself turn off the taps of violence within our communities. It's absolutely essential that we have access to care and support for women experiencing violence, but it is also essential that there is a broader programme of violence prevention work going on within communities, and this has largely been stopped. So that's very much the negative side of COVID-19. What about ending by thinking about opportunities in the crisis? There's much to learn about gender-based violence from lockdown measures and their impact, particularly on alcohol and social engagement. And it is interesting that the official figures from the South African police of rape of women in particular, and certain other forms of acts of violence against women, but particularly I've seen the rape figures, show that during the period of hard lockdown in April and the beginning of May, there was actually a huge decline in reported cases to the police of rape. Now, we know that only a fraction of cases ever get reported, but it doesn't seem very likely that the proportion of cases being reported would have very substantially changed during this period, bearing in mind that police stations have remained open. It does seem more likely that underlying this, there has been a reduction of rape. And we don't know what has been going on with physical violence against women, although it looks overall that during the period murder also reduced. at the Medical Research Council, we are going to be conducting research next year looking at intimate femicide during this period. But at the moment, all we have to go on are the police statistics. We know that there were many factors at that time, and it wasn't just a reduction in the role of alcohol at that time, but there were also restrictions in social mobility, and we do need to, at some stage, try and untangle those to try and think about the impact. But it's difficult to escape the fact that it seems that the reduction in access to alcohol did play a role in the reductions to women's exposure to rape during that time. And we suspect, because of the impact on crime reporting overall, violent crime reporting, other violence against women, certain forms may have been reduced. And I think it's incredibly important that we recognise that South Africa as a country has unusually high levels of alcohol consumption amongst those people who drink alcohol within the population. And it really is time for us to look at measures to establish a new normal in respect of access to alcohol and availability to alcohol in order to contribute to the national efforts to reduce violence against women. It's not going to solve the problem. We're not dealing with a problem that's solely driven by alcohol. There are many, many factors, but it clearly is a factor in terms of violence against women, and we clearly need to address that. It's absolutely essential that we support measures to uplift the economy and fill gaps in households, and that we recognise that these differentially impact women. And it's really important that we go back to the discussions around continuing various forms of grant support for, particularly for women, whatever modality is actually decided on. But it is essential that we recognise the fundamental injustice of poverty within our society and the way in which it differentially impacts women and children. And I think that it's very important that we recognise that the Solidarity Fund and the National Strategic Plan for Gender-Based Violence and Femicide have provided funding and a framework for delivering services during this time. It's really important that they've provided funding to the women's movement within the country, which is so critical for getting services out and support out on the ground and into communities, reaching out to women experiencing gender-based violence. But it's incredibly important that the work they've been doing in extending counselling and support is matched by efforts to prevent gender-based violence, and that we see the mobilisation of resources to fund effective prevention work within communities, building on modalities of interventions that have been shown through research to work and implemented and designed in ways that really show promise for them being able to effectively take forward the agenda of gender-based violence prevention. So I want to end by saying it's incredibly important that we recognise these links between gender-based violence and COVID-19, and that we see this as being an opportunity for us to go forward and rebuild our society as we emerge from the COVID-19 period, bolstered on the platform of vaccines and the other interventions that enabled us to move forward. But we need to establish a new normal, and we need to take gender-based violence prevention squarely into the future of our work in order to build that. Thank you very much.
I think we've lost Professor Christof. Sia, advise, I think we've lost Professor Christof.
Yes, I think so too. May I suggest that Sandy could proceeds and give us a bit.
Thanks very much, Dr. Belani. It's an honor to be part of this discussion. So my presentation, I think, complements Rachel's presentation very well. I've been asked to focus on economic, social, and cultural rights and the impact of the COVID pandemic on these rights. So I think more than anything in recent times, the pandemic has really illuminated the vital importance of this group of rights. So many countries in Africa lack strong public health systems, efficient food distribution networks, comprehensive social protection, access to water and sanitation services, particularly to informal settlements and in rural areas. And this has really set back efforts to combat and respond effectively to the pandemic, and is also going to set back efforts to recover from the pandemic. So these trends are very vividly illustrated in South Africa, where, as this audience knows, still bears very deep scars of poverty and inequality from the apartheid and colonial eras. So before the pandemic, 55% of the population were considered poor in 2015 figures by Stats South Africa. This was in terms of the upper bound poverty line. In terms of the lower food poverty line, a quarter of the population fell below this line. These were the people that were regarded in extreme poverty, unable to afford enough food to meet their basic needs. Also, as Rachel has highlighted, poverty is very much feminized. So the poverty rate for female-headed households was almost 50% compared to 33% for male-headed households. Moreover, as the UN Committee on Economic, Social and Cultural Rights noted during its review and concluding observations on South Africa's initial report, income and wealth inequalities in South Africa remain unacceptably high, in fact, amongst the highest in the world, with a Gini index of 0.63 and a Palmer index of 7.1. The latter means that the total income accruing to the richest 10% of the population is 7 times the total income accruing to the 40% poorest of the population. And wealth and asset inequality is also extremely high. Since the outbreak of the COVID pandemic, South Africa has become the country with the 5th highest number of COVID cases in the world and the highest number on the African continent. Its overall GDP is expected to decline between 5 and 8% in 2020. And the UNDP estimates that it will take at least 5 years to recover. They estimate that 34% of households are likely to exit the middle class into vulnerability. So although government has adopted a number of special programs, socio-economic relief programs to cushion the impact of the pandemic, these include the special temporary employee relief package, the 350 Rand COVID special grant for people unemployed and not receiving other grants, the grant top-ups such as the additional 500 Rand to caregivers of children, and the 500 billion Rand stimulus package announced by President Ramaphosa in April. Nevertheless, the impact of the pandemic has been devastating. So as the National Income Dynamics Survey showed, in June 2020, 37% of people ran out of money for food. In April, this went as high as 47%. Moreover, they show that between February and April 2020, there was an 18% decline in employment, so 3 million rand of net job losses. But these job losses and these socioeconomic indicators were not uniformly spread amongst the population. They had a disparate impact on groups who were already vulnerable to socioeconomic exclusion and systemic discrimination. So of the 3 million rand job losses between February and April, these were concentrated among women. 2/3 of the job losses were by women, Black persons, youth and less educated groups in lower income households, and informal sector workers. In the second quintile of 2020, 45.7% of women compared to 38.9% of men were unemployed. And 46.3% of Black persons were unemployed compared to 14.3% for white persons. Moreover, the NIDS-CRAM, the National Income Dynamics Survey, found increasing educational inequality during the lockdown. So children from poor income schools were least likely to attend school and were most severely impacted by a lack of adequate digital connectivity, as well as the suspension of the school feeding program, which was then declared unconstitutional by the High Court in July 2020. South Africa already has a high dropout rate, which is in excess of 50%, affecting mostly learners in poorer schools. And this is likely to climb even further as a result of the pandemic. Moreover, as you are all aware, South Africa has a dual-track healthcare system with an under-resourced, overburdened public healthcare system serving 84% of the population, while a vastly better resourced and equipped private healthcare system serves 16% of the population. The National Income Dynamics Survey showed that the burden of poor health worsened during the pandemic on a range of indicators, particularly among Black people and women. We also see these patterns repeated in housing and evictions, where although there was a moratorium imposed on evictions, there were still accounts of a number of evictions of people, particularly in informal settlements. The most graphic case being the humiliating incident of Mr. Bulani Kwalana, who was evicted from his informal shack. He was naked at the time in July 2020, and this led to the Cape High Court imposing a temporary interdict against the City of Cape Town's Land Invasion Unit, Anti-Land Invasion Unit, for this kind of eviction without a court order. So indeed, the socioeconomic indicators are dire, and at the same time, as we emerging to lighter lockdown levels, lockdown level 1 currently, many of the special COVID socioeconomic relief programs are coming to an end. So the TERS UIF program is valid until came to an end in October, and applications are being processed until end of December. The top-ups to the social grants also ended on the 31st of October. And the special COVID 315 grant for unemployed people has been extended, but will come to an end on 31 January 2021. So in this scenario, a key issue is going to really be how to rebuild and to re-establish the socio-economic recovery program. However, what is turning out to be a key source of controversy is the fiscal consolidation measures, which have become a major feature post-pandemic of government economic policy. So in response to the 500 billion rand rescue package and the supplementary budget tabled by the Minister of Finance on 24 June, a number of economists and researchers argued that the supplementary budget was in fact not in line with the rescue package announced by President Ramaphosa, and in fact was being financed through a number of reprioritizations from other critical socio-economic rights programs. They in fact pointed out that government expenditure would be reduced by 230 billion rand over a 2-year period and would have a severe impact on a number of areas critical for socio-economic rights delivery, such as education, particularly the infrastructure investment grant for schools, job protection and creation, housing, agriculture and rural development, and renewable energy generation. The response from government sources was to say that South Africa's budget deficit this year will exceed 700 billion rand, and that South Africa is on the precipice of an unsustainable debt crisis that could place us in danger of a sovereign debt crisis. Tax collection numbers have shown big shortfalls, and South Africa has already had to turn to the international financial institutions for loans, with a loan of about 75 billion rand from the IMF at the end of July. To compound this gloomy picture, international rating agencies again downgraded South Africa's credit rating in November. So this places South Africa and a number of similarly placed African countries on the horns of a dilemma. Building up universal healthcare systems such as the National Health Insurance, establishing comprehensive social protection, enacting land reform, ensuring that the inequalities in education are reduced, are all going to require substantial investment of resources into the social sectors of the economy, including in the public service who is mandated to deliver these programs. But at the same time, the deepening fiscal deficits and the deep debt crisis I referred to threatens to undercut the investments in the very social programs needed to build a just recovery based on the progressive realization of economic, social, and cultural rights. And these are commitments South Africa and other African countries have made in terms of their constitutions and by their ratification of regional human rights instruments such as the African Charter on Human and People's Rights and the International Covenant on Economic, Social and Cultural Rights. So this brings me to the question that Christof Heyns posed in his opening address, which is, what are the tools that human rights and economic and social rights provide us with to help getting us off the horns of this dilemma that I've just sketched? Well, I want to here highlight two particular tools that economic and social rights doctrine and the international instruments I've referred to reference that are very important. The first tool is basically that of the concept of retrogressive measures. Basically, this doctrine in international social and cultural rights says that states are obliged to improve progressively people's access to economic and social rights. Where there is an extreme crisis and where they need to, they can, under extraordinary circumstances, have budgetary and cutbacks in delivery. But there are certain criteria which are imposed by international law and on the relevant ministries before such measures can be adjusted or adopted. And these include a human rights impact assessment, which is designed to detect whether such measures are seriously necessary, whether they go no further than is strictly necessary to combat the emergency. So in other words, the principle of proportionality, that access to minimum core levels of the rights are not prejudiced, and that the measures do not result in any direct or indirect discrimination against vulnerable groups. There are also certain process-related obligations such as transparency and people's participation in the processes of making these very hard decisions around prioritization of resources. And then just briefly, because my time is up and perhaps we can come back in question time, just to mention the second very important principle, which is contained in the International Covenant on Economic, Social and Cultural Rights, which is the principle of international assistance and cooperation. This is going to be key for debt relief and debt forgiveness for many African countries, but also, as the UN Committee on Economic, Social and Cultural Rights recently highlighted, for universal and equitable access to the COVID vaccine. And there cannot be a sustainable recovery in Africa or South Africa without international assistance and cooperation being at the heart of such measures. So I think, Christof, I'll end off now with those remarks and come back to my further recommendations in question time. Thanks very much.
Thank you very much, Sandy. Much appreciated. Sorry on my part, I think my internet is suffering also from end of year fatigue and abandoned me for a few minutes. So I'm sorry to have left the ship for a while. But thank you very much to Rachel and to Sandy, really, for very insightful and at the same time troubling presentations, but also pointing us at least in terms of directions that should be explored. I'm not sure that Sandy was properly introduced. If I may just retroactively say that, as many of you know, she's the H.F. Oppenheimer Chair of Human Rights Law at the University of Stellenbosch. She's widely recognized as a leader in the area of socio-economic rights in South Africa, but also a world figure on the same topic. She's made an enormous contribution in the last 4 years as a member and as vice chair of the United Nations Committee on Economic, Social, Cultural Rights, the body that monitors the global compliance with a covenant on economic, social, and cultural rights. So we're very happy to have her with us as well. So our last speaker on the panel will be Professor Christopher Mbazira. He's indicated on the program as associate professor. In the meantime, he's a full professor, and congratulations, Christopher. He's the principal of the School of Law of Makerere University in Uganda. He's widely published and is a leading authority on socio-economic rights, in particular its judicial application. He was also, in addition to his academic work, amicus curiae in important cases that have dealt with this particular issue. So we're delighted to have him back, and Christopher, the floor is yours.
Thank you so much, Professor Heyns. Good afternoon, good morning, all colleagues. A pleasure to be here today, and thank you so much for inviting me to be part of this very, very important discussion. I was asked to focus on social and economic rights, just as Professor Lebenberg has done. By the way, Sandy was my teacher so many years ago, and that's something that I cannot forget. She's my mentor in this area of economic, social, and cultural rights, and I'm always proud to see her and associate with her. I'm going to be brief in my presentation. First of all, a lot has been said. There's a lot of information out there on the impact of COVID at the global level, but also at national levels. Indeed, Uganda has also been impacted on by COVID. But just to start with the international perspective, the COVID problem is not the first pandemic that we are seeing. We've had pandemics before. The 1919 Spanish flu and its effects is well documented. We've also had viruses in our times. Ebola has been ravaging, especially the Great Lakes region, of which Uganda is part for so many years. The SARS, bird flu, all these have been pandemics that have been around in our times. But we all appreciate the fact that the impact of COVID-19 has not been like any of the other pandemics that we've seen. And there are various differences here. One of the most visible is the speed at which the virus has spread, engulfing the world map at unprecedented speed overnight. We would see one country registering so many cases, and some countries thinking they are safe. The next 2, 3 days, 4, 5 weeks, we see that the other countries have also been affected. And the other thing that clearly distinguishes what we are going through now from what we've gone through previously are the unprecedented lockdowns that have come with the virus. Again, we've not seen this in the world before. And these have caused unprecedented interruptions to the international economic system, impacting mainly on international trade in goods and services. In addition to this, of course, the impact on the international trade in goods and services is the most visible. But there is another invisible impact, although visible, but not as clearly visible as the impact on trade, which is the disruption that has happened on international governance systems. And not only systems at the global level, but also systems that are regional and also national level. And definitely this has an impact on the enjoyment of economic, social, and cultural rights. There is no doubt, as we know, that the enjoyment of these rights is dependent on well-functioning international and national systems. For instance, we know the international system that facilitates trade in goods and services, creates employment, it provides income that people use to access economic goods and services. it facilitates the movement of very essential goods and services that impact on the enjoyment of economic, social, and cultural rights. But what we've seen in, as a result of interruptions in this system, we've seen job losses. We know that so many companies have closed down. I don't have time to give the figures. And it's anticipated that more businesses are going to shut down, even when the lockdowns have been lifted. In some countries, we are going to see a progressive shutdown of workplaces. And productivity has also gone down, and when productivity goes down, the income goes down as well. We also know that the international trade system is vital, as I've said, for the global saturation of goods and services that serve various sectors and that impact on social and economic rights. This includes goods that are necessary for purposes of enjoying health care, for purposes of having education, food, housing, and others. And even for humanitarian purposes, including to feed the millions of refugees that the world has. We know that Uganda, for instance, is the second largest host of refugees because of the instability in the Great Lakes region. But we immediately saw an impact on the access to humanitarian goods and services for this very huge population, which totals over 1.33 million. We also know that, again, at the international level, we have a system on which the intergovernmental agencies thrive. The intergovernmental agencies, including FAO, Food and Agriculture Organization, including UNICEF and others, play a vital role in ensuring that people get access to economic goods and social services that impact on the enjoyment of on the rights. In the early days, beginning of this year, we saw the World Health Organization being impacted on negatively, with budgetary cuts coming as a result of that. Of course, we know the politics that surrounded that, and of course, this has affected the effectiveness of these agencies to respond to the impact of COVID. So what is clear, though, is that even when the signs were written on the wall, when the virus broke out in Wuhan, we never prepared, not only at the international level, but even at the domestic level. Not even the intergovernmental agencies adequately prepared for this. So we've had this global interruption in international trade systems that has immediately impacted on enjoyment of economic, social, and cultural rights. But we've also had interruptions in the international governance system, not only affecting interrelations between states, but also affecting governance systems in terms of the effectiveness of the intergovernmental bodies, including the United Nations specialized agencies that have been key. I now want to turn to Uganda to say something about the impact that the virus has had on the enjoyment of socio-economic rights in Uganda. When, of course, we saw the virus in Wuhan, in Uganda, we thought we were comfortable. Late last year, we saw apprehension everywhere, but even then we didn't think it was going to be a serious thing until around March, when we saw travelers coming from other parts of the world actually coming with the virus. To date, Uganda has a cumulative number of positive cases. This of course includes those that have recovered, but the Ministry of Health website shows that we now have a total of 22,499 cases, and we've had 200 deaths. Of course, compared to other countries, South Africa inclusive, this could be a small figure. But from the way our systems work here, I'm not confident that actually all the cases have been documented, cases of those that are positive and also cases of those that have died, because there is a very, very limited testing, very few testing facilities. Even for residents of such urban places like Kampala, not many have access to testing services, and the services are so expensive. But what we are seeing now, there is a spike in the number of people showing up at hospitals with signs. There are a number of deaths, suspicious deaths that are happening, and this could be associated to the virus. Now, Uganda started its lockdown on 14th March 2020, and even then it was mild. It was a closure of schools. Borders were closed to travelers from certain select countries, and we thought at that stage that we were safe. But the lockdown continued cumulatively, and by the end of March, the country, like many countries in the world, was under complete lockdown. Suspension of public transport, curfew was imposed at, starting at 6 p.m. and so many other things. Commercial activities were locked down, and the country went into a complete lockdown. Now, in terms of the impact of these lockdowns on social and economic rights, they are not different from what has happened elsewhere. I think Professor Liebenberg has articulated those in South Africa. It's not so different. It's the same situation that has happened in Uganda. And here we've seen the closure of workplaces, disruption of the healthcare system, with access to healthcare services becoming a problem. Actually, when public transport was suspended, and the majority of the population depends on public transport, there are so many reported cases of people that passed on because they could not access healthcare services. They could not access medicines and other goods. Most affected were people that have chronic problems such as high blood pressure, HIV, and other chronic conditions, because they could not access they could not travel to access the services. And this is especially because most services, healthcare services, are concentrated around urban areas. Yet the majority of the country's population, over 80%, is rural-based. So when one wants to get medical services, they have to travel from upcountry to the nearest urban center. Actually, there are services that are only available in Kampala, and for certain people, that means days of travel. So when public transport was disrupted, of course, such people could not access the services. Education has been affected, the school and universities, but even then, the majority of the students and the learners are still home. It is clear, as was the case and has been the case everywhere, that our healthcare system was not prepared to deal with the problem. Initially, the numbers were small, and based on that, we thought that maybe the system can handle somehow. But the numbers have been increasing progressively. But by March, for instance, it was reported that the country, with a population of over 40 million people, had only 55 functional ICU beds. Yes, the government has done something to increase this, but it's still less than ideal. Countrywide, we have less than 300 ICU beds, and moreover, the majority of these are concentrated in healthcare facilities. Actually, what is happening at hospitals now, hospitals are turning away patients because they don't have ICU beds. It's only the National Referral Hospital that has the biggest number of ICU beds, and yet at the moment it is overwhelmed. Now, in terms of social protection, we've not had a comprehensive system of social protection, equivalent, for instance, to what South Africa has. We have very, very limited social protection, moreover, which is not entrenched. So sometimes it comes in place as a result of political conveniency, where you have a system that provides certain benefits, for instance, to the youth or to children, and then it disappears. For now, the only entrenched social protection package that we have is one that caters for the elderly. That one has now been entrenched, but it's only being rolled out to the country. Initially, it was a pilot project. For so many years, it was a pilot project. So in such a circumstance, when workplaces were closing, there was totally no social protection system to ensure that people get access to goods and services, including food. There was a hushed response from the state to supply, to give food rations, but even that came with so many problems. For instance, it was only Kampala that was focused on. The diagnosis from the side of government was that the lockdowns were only affecting poor populations in the urban areas, but even then, the government didn't have the capacity to give food to all poor people in all urban areas. Only Kampala, and even the quality of the food was questionable. Now, generally, the country has we remain one of the poorest countries in the world, but things have been changing. In the last 20 years, for instance, especially between 1996 and 2016, we saw a dramatic drop in the percentage of the population that lives below the poverty line. This reduced from 54% in 1994 to 20% in 2016. But worryingly, 2017 and going through up to 2019, again, there are studies that were showing that many people were slipping back into poverty because of the performance of the economy at the time. So what COVID has done, we don't have the figures now. We are yet to get the figures from the National Bureau of Statistics. But there is no doubt that COVID has definitely aggravated that slip. So we are going to see a spike again in the proportion of people that are living below the poverty line. One would have expected, just like so many countries did. Professor Sandy has mentioned some of the responses from the South African government in terms of ensuring that there is stimulus and social protection and such things. But in the case of Uganda, the timing was so bad because this next year we are having a presidential and parliamentary elections. And what happens here is that whenever elections are coming up, the ruling elite concentrate all their efforts and resources on ensuring that they win the election. So right now we see a lot of money is being pumped into elections, and so many areas of spending have been suspended. For instance, I work in a university. There are certain things that in respect of which expenditure has been frozen. It's only salaries that are being processed, but other things, and this has affected all government institutions because the money is being channeled towards elections. So the election fever, combined with the COVID economic impact, is likely to see so many people slip back into poverty. COVID is also being used as a tool for electioneering, where the various COVID regulations, especially those on public gatherings, are being used to justify state-inspired violence, where the state is cracking down, especially on opposition politicians. But this is driven by the need to cripple the opposition and ensure that the ruling elite retains power. Of course, there is a connection between this and the enjoyment of economic, social, and cultural, because we know meaningful elections provide a platform for holding the political leadership accountable. But that is something that we are losing. The domestic violence and other forms of gender-based violence, just as has been demonstrated in South Africa, is not different from Uganda. So many reports show increasing cases of domestic violence, and this is connected to the stresses. But as I conclude, the dimension I want to bring in, at the start of the COVID lockdown in March, Uganda was finalizing its third national development plan. We know the development plans, that's the blueprint for the country's development that is going to be followed for the next 5 years. I was lucky to be involved in this process. I was advising the National Planning Authority on how to integrate human rights in the plan. And my call was to demonstrate how the human rights-based approach can actually be used to inform development planning for a country. But one thing we were not giving attention to at the time was to look at the superstructure and political economy of the plan, superstate structure and the political economy that the plan was building. But when COVID struck, we realized that actually we had to look at this. And what we discovered looking at the plan that this plan was intended to replace is that so much emphasis had been put on private sector-led development, like the private sector is what was going to deliver. When we looked at the draft, we saw that there was a bit of a shift from the private sector, but even then that was not drastic. The private sector still remained at the center of delivering the country's development for the next five years. But the realization was that with the vulnerability that is arising from COVID, the private sector definitely could not deliver because the private sector itself is constrained in so many ways. So in terms of reaction, we concluded that we need to have state intervention on a scale that we've not seen before since the late 1980s and early 1990s when the World Bank intervened in Uganda, like it did in many African countries, and asked the state to withdraw from the provision of vital goods and services. We now need the state to bounce back and take charge and use that to build a strong social protection system that is going to deal with the vulnerability that we are seeing. Lastly, and again to touch on what Professor Sandy has touched on as she was concluding the tools, one tool that we see visibly necessary is the state to fully embrace the human rights-based approach to development, because this helps to address vulnerability. It puts vulnerability at the center of development activities of the state. So we need the state to intervene in that regard by in whatever it does. Professor Liebenberg has mentioned the human rights impact assessment. We are advocating for the same. There is actually a draft law on the subject. So we're now calling for that law to be fast-tracked and adopted, so that whatever the state does, there is that impact assessment, and one of the areas of focus should be on how to address the needs of the vulnerable. Part of the human rights-based approach is to put emphasis on bottom-to-top planning. In our policy and legal framework, bottom-to-top planning is what is envisaged, but in practice, what we've seen is top-bottom planning. So that is something true that needs to change, so that we emphasize in practice bottom-top planning, because the vulnerability that we are seeing is both macro and micro, and the one which impacts most on the people is the micro impact, micro form of vulnerability.
Christopher, sorry,
yes,
could I ask you to wrap up and perhaps put the last points in the conclusion? We just want to allow still some time for discussion. Yeah,
sure. That's the last point.
If you could wrap up, and then we're over to the discussion. Yeah.
Okay, Prof, that's the last statement I'm making, that we need to promote bottom-top planning to ensure that the vulnerability at a micro level is addressed. I'll leave it at that. Thank you.
Thank you very much, Christopher, and thank you very much for the overview also of the position in Uganda, which I think from our perspective is also very interesting, and then also your emphasis on the importance of the trade system and the impact on the refugees. So thank you very much to all the panelists. We have a few minutes left for questions, and then I'll ask the various panelists to wrap up. There's one question in the question box already, but you're also welcome to raise your hand. So if you go to where the attendees are, there at to participants, you will find there where you can raise your hand, or you can simply come in on the question box, or if you want to raise my or attract my attention, please just come in. So is there anybody who wants to take the floor right away?
Yeah, I think
I see
Christof,
Anne Skelton. Yeah, I see Anne Skelton has her name up. So can I give the floor to Anne Skelton? Anne, would you want to take the floor? Okay, I don't hear anything from Anne at the moment. There was a question from Thomas Probert to Rachel, to Professor Jukes. So the first area was the one of the figures, the national figures, the accuracy of the national figures on domestic violence. And then the second one is whether the programming aimed at protecting children from all forms of violence in the home might have a broader impact on also on adult victimization. So that question for Professor Jukes. And then Anne Skelton, I've been looking at derogations as the Committee on the Rights of the Child, and now it disappeared from the screen here. So, Anne, if you want to put your question back in either the question and answers or in the chat box. But if there are no other questions, we can ask Professor Jukes to respond to Thomas Probert.
Thank you very much for the question. There are sort of two aspects to this. One is it relates to the size of the population living in informal settlements. And unfortunately, it's still 20% of our population. So it's a minority within the country, but it's not a small one. The question about whether the demographic and health survey type figures underestimate violence is a very important one. And, you know, on the one hand, I have to say that the ballpark of their reports has been one that we've seen across larger population-based surveys at different time points in South Africa. And we hadn't seen a very large number of these done, and the demographic and health survey is the biggest. So it is in the same ballpark as some of the other surveys, but it's it does present a prevalence that's much lower than we find in smaller targeted surveys. So there is a huge question about what exactly is going on there. And I think the second part of your question relates to child abuse, and child abuse is an incredibly important driver of intimate partner violence, because we know that children who witness their mothers being abused, if they're boys, are more likely to grow up and perpetrate when they're older, and if they're girls, they're more likely to become victims. And we know that the experience directly, particularly of sexual abuse and emotional neglect and physical abuse, is such that boys who experience these are more likely to grow up to perpetrate, and girls again to become victims. So there is a cycle of abuse within households that it is absolutely essential that we break, and it's really important that we focus efforts on the way in which children are raised, which is again intimately related to the socio-economic and other circumstances, including the mental health of parents and so forth, in child rearing, as much as it is around cultural aspects of child rearing and the use of violence and the way in which children are positioned within homes. So a key task in terms of prevention of all forms of violence within the country. Thanks for the question.
Thank you very much, Rachel. So in the meantime, we have a question from Anne Skelton, why socioeconomic rights are never considered non-derogable. So if Sandy or Christopher can come back. And then there's a broader question from Laratu. asking where government social responsibility will end after the COVID-19 pandemic. So can we go back to the panelists on that? Sandy, would you come in on the derogation?
Yes, thanks very much for those questions. Thanks, Anne. And I'm sure Christopher will also like to supplement. So I think from the perspective of derogations, meaning in a state of emergency, you know, to what extent can government derogate completely from its human rights obligations? Now, the South African Constitution has a derogations clause, but subject to a strict principle of proportionality. So in other words, you can go no further than is strictly required by the necessity of the situation. And it also has a table of non-derogable rights. So for example, human dignity, freedom and security of the person, certain aspects of children's rights are non-derogable. However, under the International Covenant on Economic, Social and Cultural Rights, there is no derogations clause, but there is a limitations clause which basically recognizes that rights can be limited where for important public purposes. But again, the principles would be that they must be compatible with the nature of the rights. So, you know, one can't, the committee has interpreted this to mean you can't take away minimum essential levels of the rights, the so-called minimum core obligations, and it must be proportional. So you can't go any further than is strictly necessary. So the feeling is very much that, you know, the proportionality principle, which is part of the limitations provision, is sufficient to cater for any situation of needing to limit socio-economic rights under an emergency or a situation like the pandemic. And the concept of retrogressive measures is in fact a very similar test to a limitation style inquiry. So I don't know if that is a satisfactory answer at all, but that would be my take on the derogations limitations. Thanks, Christof. And once Christof has come in, I could say also just a word on Lorato's question, but I'll come back for that.
Thank you very much, Sandy. And perhaps I could ask, so we have 3 minutes left. We also note Arjuna's from Sri Lanka's comment. Perhaps I can ask the panelists if each come back for a minute with their concluding observations. So Christopher, if you could then come in on the last question. If there are no further comments, but I saw Zora has his or her hand up. So let's give Zora a chance and then I'll ask the panelists to conclude. Zora, please take the floor. I'm not sure whether the chat function actually works for attendees. Zora, do you want to raise something in the question and answers, perhaps? And then let me ask the panelists to start, and then if Zora's question come in, then perhaps you can also respond to that. So, Rachel, could I ask you first just a brief summary of response to your impressions from today?
Well, thank you very much for the questions and for engaging. I think this has really been an incredibly important discussion, because I think that looking at the question of rights within the context of COVID and the way in which COVID has impacted on so many different aspects of our lives, including our experiences of violence, but very critically on access to socio-economic rights, and this inseparable relationship between these and access to violence is absolutely and experience of violence is absolutely critical. And I think it's really important that we open the discussion. The question about how we go forward into the future and is something that we can't really resolve today. It's something that's going to unfold over the next period of years to come. But I think it's incredibly important we've had the opportunity to open up the discussion. So thank you very much.
Thank you very much, Rachel. Sandy, would you go next?
Thanks, Christof, and thanks also everyone for their participation and great comments. So just, you know, the critical question that Lerato posed, you know, when will government social responsibility post-COVID end? And I think this is vitally important because, as I tried to mention, a number of the important support programs are coming to an end in January, and we're entering into an era of fiscal consolidation where a number of key budgets are going to be cut, including, you know, at local government levels for housing, for school infrastructure, and so this, you know, really is going to be crunch time because, you know, similar measures adopted in the wake of the financial crisis of 2008 and to 2009 internationally are arguably at the heart of the difficulties countries in Europe, particularly Spain, has had in responding adequately to the pandemic. So are we going to walk down that path of austerity again, and what will be the implications? And then this links up very much to the points Christopher was making about, you know, that we need to integrate human rights principles much more seriously into macroeconomic and budgetary decision making. At the moment, you know, there's almost no reference to them in the recovery plans and in the supplementary budgets and so forth. Human rights impact assessments simply don't feature. That is why I'm really interested in the Ugandan draft law. But, you know, it's no good having all these good policies on gender-based violence and socio-economic rights provisioning if the money is not there and if we don't have financing for it at the end of the day. And then just to end on a more hopeful note, to say that at least the one positive feature is that the COVID pandemic has revitalized debates around social programs such as a potential basic income grant, also debates around a potential wealth tax. And I think the extent of the crisis has really emphasized the need for more far-reaching measures to be taken. So thanks, Christof.
Thank you very much, Sandy. So we're about to close. Christopher, you have the last word.
Yeah, just very quickly, thank you so much, Prof, and thank you everybody for the comments and questions. For me, the takeaway from this is that we need to understand that the world has had several shocks. The financial crisis that we had a few years ago and the austerity measures that Professor Sandy has mentioned should have taught us lessons that we need to review the role that the state is playing, because the state has retreated and left so many things in the hands of the private sector. And the private sector is so connected to the global financial system that has not favored the vulnerability, that has not favored the human rights-based approach. So I think we have to go back to the drawing board and look at the global economy, look at the political economy, and ensure that we actually build an intervention state, a state that invests a very big proportion of its resources in ensuring that there is social protection. Prof, I'll leave it at that. Thank you.
Thank you very much, Christopher. So, ladies and gentlemen, that brings us to the end. Let me thank our panelists, Rachel, Sandy, Christopher, very much for sharing their expertise with us. I think it's been immensely helpful. I certainly take home the idea of prioritization that is required, but in that process of prioritization, to make sure that the essence of human rights remains within the area of violence and also in the area of socio-economic rights. So thank you very much to MASSAf for organizing it, and thank you very much for everybody who participated today. All the best.